When he said you have diabetes, I didn't get terribly upset because I didn't feel any different.
I'm trying to manage the diabetes, not the diabetes manage me.
This is a disease. It's not going to go away. But with good management, good physicians, you can have a healthy life.
I'm Susan Hunt, and today we're going to talk about diabetes. It's estimated that 80 million people in the United States have diabetes or are on the verge of developing it. About 6 million people with type 2 diabetes don't even know they have it yet. It's a serious, lifelong condition, but there's a lot you can do to protect your health. You can live well with diabetes.
We're all at risk. It's the epidemic of modern age.
Okay, 1, 2, 3.
There are certain days that I wonder if I did a family medicine residency only to become an endocrinologist. People are sometimes shocked and surprised when you tell them that their sugars are elevated and that they have diabetes. They won't sometimes believe you. There's a multitude of organ disease that goes on with diabetes, and it's not as simple as treating the sugar. We have to be very aggressive with treating pretty much the entire body, focusing on the eyes, the kidneys, the heart. I think it's important to educate folks, and that can be partially through their healthcare provider. It can also be through a nurse, such as a clinical care coordinator that we have in our office.
The thing that affects your blood sugars the most are sugars itself or the carbohydrates. That's what makes your blood sugars high.
And also through diabetic education, where you see a certified diabetic educator, nutritionist. We encourage our folks to go to the classes, learn as much as they can.
The best time to exercise when you have diabetes is an hour to an hour and a half after a meal.
Patients that always do the best, the patients that have the least complications, the least visits to the hospital, the least visits to the ER, are the people that buy into the idea that I'm only part of this process. I mean, I'm sort of the quarterback, I guess. I call the plays, but I'm going to give you the ball and see where you're going to run with it.
I was pre-diabetic for about a year now. We've been watching it. That's when we started coming to some of the classes.
We have whole wheat pizza with asparagus and feta, spicy beans and greens, buttery lemon shrimp, and tart and tangy cherry salad. For diabetes, it really is about overall healthy cooking.
When he said you have diabetes, I knew it was serious. I knew it was an illness, and it's something you'll probably have the rest of your life, but I didn't get terribly upset because I didn't feel any different. I figured, well, I really have it now. I'm going to be on medication. I'm going to have to make some changes, but I've dieted on and off all my life, and I wasn't going to change anything very drastically.
We know that with diabetes, you should be having whole grains. Whole grains help blunt the effect of on the blood sugar of the carbohydrates, so they're absorbed more slowly.
Started coming with a girlfriend, and the two of us are both overweight. She's diabetic, so am I. We've just made gradual changes. We've learned a lot of little hints from Pam, like the whole wheat flour. I don't buy the white flour anymore.
And we're going to use a little bit of Splenda, some sugar substitute here.
Yeah, we got a lot of great recipes. We all talk. We discuss some of our problems. It's a lot of fun. I love to bake, I love to cook. And that part's been an adjustment.
Your life does not have to be turned upside down because of diabetes. And that's really the point, is that you can make small changes within your lifestyle and really at your pace that will make a big difference down the road.